Since 1981, the European Hospital and Healthcare Federation has organised the Hope Exchange programme. It consists in a 4-week training period for managers working in hospitals and healthcare facilities. The aim of the programme is to promote a better understanding of the functioning of healthcare and hospital systems within Europe by facilitating cooperation and exchange of best practice.
I joined the programme because as a health service manager, we often are not very good at sharing ideas and learning from other people. So I thought it would be an opportunity to travel to another country, to find out what other health services are doing, and also perhaps to share best practice from my hospital and learn best practice from another hospital.
I am on the way of hospital management development just since a very short time. I am engaged since 1 year, so for me the program has been given by a very experienced team from Holland. Seems to be the best source of knowledge I can find.
And I thought it's a great opportunity and I want to join that.
The Hope Exchange programme is not a medical or technical programme. It is a practical and multi-professional management programme. Doctors, nurses, but also economists, lawyers and other professionals are very welcome to join.
Really to compare how the healthcare system is different in Spain compared to Scotland, and also because I work in human resources, things related to human resources like the training of doctors.
In the first place it's very just interesting to see how it works in another country, but then I also wanted to get input within my own field of where I'm busy, within the supplying of medicines in the hospital and in the surroundings. So I wanted to see how they're doing it in another country.
There is a wide range of host institutions we collaborate with, sending or receiving participants, both in the private and public sector. Thanks to all of them, every year more than 100 professionals are able to do their training in more than 20 countries in the European Union and Switzerland.
We want to activate our members, which are the hospitals in the Netherlands, to see other people's perspective of how they work in other hospitals in Europe, and they also want to share their knowledge in their hospitals with people who are coming from abroad.
SESCAM participates in the Hope Exchange program because we gain an experience for our professionals and for the institution itself. We normally send away 3, 4, 5 people, 5 professionals. They are normally healthcare professionals but with responsibilities in management, and we receive 2 or 3 persons from the European Union.
And we participate in the program now since about 5 years. So we have had a couple of people going out, and we have had the pleasure of having a few people here.
So each year is different. Not only depends on the country of origin, but also in the background of the person. For example, sometimes they are physicians, sometimes they are nurses, sometimes they are engineers or economists, depends. So we gain a lot of this variability, and for us it's very rich to have all these kind of backgrounds and experiences.
And we are very enthusiastic about the program. What we hear and see from the people who come here, they are quite excited about the opportunity to learn, not only about a hospital here, but also about the methodology and the way we do these kind of things here in Holland. And it is quite interesting for the people in our hospital because they learn from the experiences in other countries. So it is a lively debate about all kind of different topics about the hospital, the way of organizing things.
I'm feeling quite very good here. All the staff and all the persons we met here are very kind to us. They are sort of like very trying to tell us as much as they knew about their work and their experiences and in the healthcare here in this hospital. And what I find it interesting during the last days, that they actually have also some questions for me, and I was also able to sort of like, I hope, help them with some my experiences.
The involvement of participants and host institutions is organised by a national coordinator from each participating country. Host institutions and local coordinators also prepare a personalised programme for the participants they receive, in which they show them the way care is delivered in their area.
So I try to prepare a program for 3 or 4 weeks, and then she can visit all kinds of facilities within and out of the hospital, because we are working closely together with other partners in healthcare and healthcare organization. So we do not stay within the hospital, we go also out of the hospital and out of the city to see what happens, not only at university level, but also what happens in primary care, what happens in other cities where we work together with.
It's a very good life here. We'll stay here for 4 weeks. We live on a lovely boat, and we have program all the day from about 9 o'clock till 4 or 5 o'clock in the afternoon. And we have appointments with different people at the hospital telling us about their departments and what they're doing in the hospital within their fields.
Poland itself, we've been very welcomed on the programme. The hospital staff are very enthusiastic and enjoy sharing their work with us and what they're doing and what they enjoy and what parts of their job that they'd like to improve. So I think they have quite an empowered workforce in the hospital that we work.
So far I'm very impressed by the happiness of the people here, the way they welcome us here. Everything's perfectly organized, everybody's very open-minded. Also the people that we're having interviews with, they always seem to be happy to see us, and they're really taking their time off a very tight schedule, and that's something I really appreciate.
The national coordinator usually organises a welcome and social programme for professionals arriving in the country. This allows them to exchange ideas and experiences with other participants in the host country.
The main thing actually is that we want to start networks, and we know from the statistics we have now that for approximately 5 years after there has been some exchange, that people will be, approximately 5 years they keep up a network for the people who were in the program or for those who were there at guest institute.
It's very nice to meet other people from other countries. One thing is that you go to Spain, but another thing is that you also get the experience from the other participating countries. So I have a lot of expectations for that.
And you see in that time you really get some advantages by getting a network. For example, we have that with a few hospitals now, that they keep up that contact with the guests they had to exchange experience they have or to do projects together. Most of the time I think that less than 10% of the people who are doing that they really on a professional way keep up the experience as hospitals, as organizations. Most of the exchange and most of the networks we have are individual networks of people who say, oh yeah, I know something, I heard something about that from my colleague when I was in the Netherlands. I send him an email or I just get him on the phone.
Each year, the exchange programme focuses on a different topic. Participants will have the opportunity to investigate how this topic is developed in their host country. At the end of the programme, all participants are invited to share their results in the Hope Agora, celebrated each year in a different Hope country.
It's going really good. It's going really good. We're almost done. Ready to put it on a pin for the final presentation. I think somebody's going to give us a pin very soon and we'll just hand it in and we're done.
We went to France. The presentation in France.
How was it?
Really good. Good, very good.
Yeah.
Interesting.
I've been 4 weeks at Poland. I've been in Sweden.
I have been in Portugal, Coimbra. My experience have been wonderful.
The experience was wonderful.
And I'm very happy and very satisfied.
Very good, very good. It's the best.
There's nothing that I didn't like. There was no negatives. The most positive thing was coming and meeting people from the university hospital. They were all very kind. They put on an excellent programme for me, which was very varied but also relevant to the topic. So I feel as though, although I'm not going to be able to go back to the UK and make fundamental changes, there are some elements that I can take back and utilise in my everyday work.
And I was in the Willishaw Hospital, and it was a very, very nice stay. And we had it was a perfect exchange program. I learned a lot. Not every idea I could bring in back to Holland, but like you said before, there are some things that will sparkle and you can turn into new ideas. And that's what we were, the two of us. Vivian went to Spain and I went to Manchester. And the two of us were very motivated afterwards. So it was a very good experience.
It was very good for me to open my mind to other kind of work, or organize the institutions or the aims of the institutions, and we could see how they coordinate very good the social and the health services, that maybe here they are very separated.
It inspires you, that's for sure. It gives you new ideas how to do your job, and you also keep what the CEO was telling is the network. I'll have a contact with the other participants from 5 years ago, and you still exchange ideas. So that's very wonderful. Yeah.
All over Europe, the same trends.
Yeah.
Yeah. Very interesting.
That's
the nice thing about Hope Exchange. Yeah. We are all in the same boat, and we learn from each other.